Do you frequently feel like your heart is racing? Or do you get unusually tired after eating certain foods or taking some medicines? What if I told you that for some people, fava beans, a common food, can turn into a hidden danger? Or that a simple infection can make their skin turn yellow? These could be signs of a condition called G6PD deficiency. It's not a heart problem or just being weak, it's something in the blood. Imagine your red blood cells are like tiny delivery trucks carrying oxygen across your body. Now, think of G6PD as the body's natural shield that protects these trucks from damage. In G6PD deficiency, that shield is weak or missing. So when the body faces stress from certain foods, medicines, or infections, the truck's red blood cells break down too fast. This breakdown can make you feel weak, dizzy, and turn your eyes and skin yellow. And the scary part, it might happen suddenly, out of nowhere, but it's actually something you're born with. So why does this shield go missing? It's all about genes, the instruction manual you get from your parents. G6PD deficiency is caused by a tiny mistake in a gene on the X chromosome. That's why it mostly affects boys and men, because they have only one X chromosome. If that one has the faulty gene, there's no backup. Girls have two X chromosomes, so they're more likely to have at least one good copy. Think of it like a flashlight with only one battery. If that battery is dead, the flashlight won't work. But if you have two batteries, one bad one won't stop it completely. This gene fault is more common in people from Africa, the Mediterranean, Middle East, and parts of Asia. So if your family comes from those areas, you might want to ask, could this be why my cousin avoids certain pills or fava beans? Now, not everyone with G6PD deficiency feels sick all the time. Many people live their whole lives without knowing they have it until something triggers it. So what are these triggers? Let's play a game. Would you eat fava beans? How about taking an old-school antibiotic like sulfamethoxazole, or using mothballs at home? These can all cause a sudden attack. During an attack, your body starts destroying red blood cells fast. You might feel very tired, your heart might race, your pee could turn dark like cola, and your skin and eyes might turn yellow. That's called jaundice. It's like a fire alarm in your body. Something's wrong with the delivery trucks. In babies, this can show up as severe newborn jaundice. If you or your child ever had jaundice that didn't go away quickly after birth, could this have been the reason? How do doctors find out? They don't guess, they test. A simple blood test measures how much G6PD enzyme is in your red blood cells. But here's the catch. If you've recently had a blood crisis, the test can be misleading because the older, deficient cells are already gone. So timing matters, just like checking if your phone battery is low during a crash or after charging. There's no daily medicine for G6PD deficiency because you don't need one unless you're having an attack. Treatment is about stopping the trigger. No more fava beans, no unsafe drugs, treating infections quickly. In severe cases, you might need a blood transfusion, like giving your body new delivery trucks. The key is knowing your limits. Would you keep a list of safe and unsafe medicines on your phone? Smart move. And doctors now use guides to help pick safe drugs for G6PD patients. Since you can't change your genes, prevention is your superpower. Start by knowing what to avoid. Fava beans, a no-go for some. Common triggers include certain antibiotics, like sulfonamides, antimalarials, like primaquine, aspirin in high doses, and even some foods and chemicals like camphor, found in vapor rubs. Think of it like an allergy list, but for your red blood cells. If you're a parent, talk to your doctor about testing your baby, especially if there's family history or severe newborn jaundice. Also, wear a medical ID bracelet. What if you're in an emergency and can't talk? The paramedic needs to know, no dangerous drugs. And share the info with relatives, because it runs in families. Knowledge isn't just power, it's protection. Scientists aren't sitting still. New research is helping us understand which exact gene changes cause different levels of deficiency. Some people have mild forms, others are more at risk. Now, doctors can use genetic testing to predict who might have a severe reaction. There's also work on safer anti-malarial drugs, because people in malaria-prone areas with G6PD deficiency were stuck, treat malaria, and risk a blood crisis. Now, new drugs like tafenoquine are being used more safely with testing first. And did you know, gene therapy is being studied, not yet ready, but imagine one day fixing the faulty gene like a software update. Also, mobile apps now exist to help people check if a medicine is safe. So next time you get a new prescription, wouldn't it be cool to scan it and get a safe or unsafe